Welcome to KW Conversations, where we discuss the workforce and education issues that matter in the Louisville region. This show is brought to you by KentuckianaWorks, the region's Workforce Development Board.
Welcome to another episode of KW Conversations. My name is Angella Wilson, Senior Program Director with KentuckianaWorks. Today, our topic is that we're going to talk to two mental health workers, and we're going to learn all about their role and their journey through the fields and their career paths. So let's go ahead and get started. I'm going to actually have them introduce themselves. So we're going to go ahead and start off with Ludmilla. Mela, would you tell us a little bit about who you are and what you do?
Well, hello. Yes, I am Ludmilla and I am one of the talent acquisition partners at 7 County Services. And so I take care of the recruiting side for mental health care workers.
Wonderful. Thank you. Kourtnee?
You're welcome.
All right. Well, I'm Kourtnee Seymour. I'm an LPCC, licensed professional clinical counselor at 7 counties. My current role is a clinical supervisor at one of the child and family locations.
Great. Thank you. Thank you for taking your time out of your day to help educate the job seekers, because these conversations are really for people that might be interested into this field. So our conversation today is going to provide guidance to them about what the process has been like for you, provide them a lot of different resources. So what we typically like to do in these conversations is, let's start off with the data, right? And so we have a wonderful LMI department, which is the Labor Market Intelligence. And what I asked her to provide is data as far as representation of people of color in the mental health field. Now, we know mental health is broad, so there's a little bit of a breakdown. And one of the things we like to focus on, again, are what does the field look like when it comes to people of color. So actually looking at the data, it does not actually indicate that there's a whole lot of underrepresentation of people of color when it comes to counseling and mental health services, the career cluster in our region. So when we talk about our region, we're talking about the greater Louisville, the Louisville metro area. Now, to break that down a little bit, when it comes to total counseling and mental health services cluster, total diversity is about 24%. And out of that 24%, 18% identifies as Black or African American. When we talk about substance abuse, behavioral disorders, and mental health counselors, the total work population in our region is about 27% total diversity. And again, out of that 27% total diversity, 21% identify as Black or African American. Now, where we do see an underrepresentation is on the clinical side. Clinical counseling, school psychologists, that is only probably about 10% total diversity. And out of that 10%, only 4% identify as Black or African American. So even with, about 25% of the workforce has identified as a person of color, your interaction with someone 3 out of 4 times won't typically look like us. So knowing that, Kourtnee, I would like to start off with you. What was it that got you interested in this career path?
Well, that's an interesting question, because when I was in high school, I definitely thought I was going to be on the radio. And then I went to school. I went to Western to join the media program there. And then I was like, I'm not really interested in that. And then I started looking into the advertisement program, and that wasn't a good fit. And so then it dawned on me, I really just want to help people, and I want to be able to bring change into the world. And so that really got my attention and pulled me towards psychology and pulled me towards the counseling program at Western Kentucky. So that is what initially, just wanting to bring that change and be a part of that.
Wonderful. So Ludmilla, I know in your role, it's very unique. You are that pivotal person that connects people to the opportunities in this career path. What got you interested in being that nucleus?
Well, I started out in banking and higher education. And then I started working in the medical field, and I was recruiting in the medical field for a number of years. And during that time, I realized that what I was doing, I was giving back to the community. I was helping physicians help their patients. And so over the course of time, that brought me to the mental health care industry. And I'm still able to do that. So I feel like I'm able to give back to the community. I'm helping people jumpstart their careers, and they can serve the community in a way that's really needed.
Great. Well, thank you for that. So let's talk a little bit about, and I'm going to direct this question to Kourtnee. Describe a little bit about your role, right? Today is a Thursday. Describe what will your day be like? What's your day like?
Well, currently as a clinical supervisor, I have a number of staff that I supervise at our site. And all of those clinicians are seeing clients from ages as young as 2 to 17-year-olds. And then we also at our site, we serve 8 young adults. And then sometimes at this site also, if we are working with a child and we see that the parent is needing additional support, we also will open up the parent if needed as well. And so I am here as a support to my staff to help them process their cases, to ensure that the client's needs are being met, and making sure that the office needs are being met as well, as far as like scheduling and making sure the clinical needs are being met for our clients. So on our day-to-day, I'm having supervision. We also have students at our site as well. So currently we have 4 students that are doing their placements here. So we also have additional support for them as they transition from they're getting their master's and then transitioning into the field.
Wonderful. Ludmilla, tell us a little bit about, describe your role, and I had to say typical, right? Because each day is different, but describe a day if we were standing alongside you on a Thursday.
Well, my primary role is finding people who want to work in the mental health care industry. So I spend time, I'm reviewing resumes for applicants, contacting them, scheduling interviews, find out what they're actually looking for and what path they want with us as a mental health care worker. So it can range anywhere from an entry-level position all the way up to a clinician and everything in between, and that support staff. I also attend job fairs, looking for different avenues to recruit people, posting jobs. I'm going out everywhere, virtually and in person, to find people who are interested in working with us, and also educating them about opportunities in our industry as a mental health care professional. And so a lot of people, they don't know what that entails. And so I try to share as much information as I can and let them know that this is an opportunity to grow. We are a growing industry. And, as most places in healthcare, we need people. And so look at the options, what your options are and where you can go, because there's so many directions you can go in mental health care.
Absolutely. So that leads us to our next question, Ludmilla. As an HR manager, what is the process for someone who wants to work in this field, right? So you meet someone at a job fair, right? Mm-hmm. What's that process like for them to start day one?
Well, the first step is they have to apply for the positions that we have, and then we take them through the interview process. They will talk with me, and then I will try to get them an introduction with the hiring manager, where they can learn more specific information about that role that they will be in. Mm-hmm. Once they go through the interview process, then we have the pre-employment screenings that I take them through if they are offered a position with us. And so we do everything that because you're working in healthcare, we have to screen everybody. And so you go through the normal process of checking references, doing background checks, verifying your education. pass a drug screen, TB tests. And then once you clear all those steps, and I'm right there beside them every step of the way, get them onboarded. And then from there, their first day, they come and meet with our training institute, and they give them a background of the organization, about their benefits package. And then they take them through the orientation process to learn about what we offer, because with Southern Counties, we are so big and that there's a lot out there that you're not going to know right off the bat. So we want to give them the information they need to get them started, and then learn the training part with the systems that we work with, so that they can be successful in their position.
Wonderful, wonderful. So to continue that conversation a little bit, for those that are interested in the field, and those that have a criminal history or a troubled past, what type of opportunities are available for them?
Well, we are a second chance employer. And so what we ask is that they have a clean background check for the last 2 years. And if they have a clean background check, then there's a good opportunity that they can come work for us.
And when you mean clean background check, as in no new activities or charges for the last 2 years, correct?
That is correct.
Okay.
Yes.
Right. So Kourtnee, I would love to get your expertise on what type of person is best suited for this work. Because if you're thinking about the mental health field, you are dealing with maybe a vulnerable population, right? So who would best be someone to enter into this type of caregiving role, no matter where they are in the organization?
I think one of the most important things a person has to have is compassion. You have to have a compassionate heart for people, because as you mentioned, people are coming in with different things that they need to get addressed in different stages. And so you have to have compassion and meet people where they are. And then you also have to have a love for people in general, just being able to have a loving heart and want to be able to help in any kind of way. And so I think those things are key elements to be able to be successful in this field, because if you don't have a compassionate and you don't have a loving heart for people, this work would be exhausting after a while. And so I think those things are key elements to be able to do great in this work in this field.
Wonderful. So Ludmilla, to add to that, right? Compassion, kind heart. Are there any other attributes? And as an HR recruiter, how do you vet that? Is it something that can be seen on a resume? Is it past experiences? How does someone convey that to you?
It's all of those things that you mentioned. And so what I'm looking for, definitely, as Kourtnee mentioned, is someone who has compassion, who wants to work in the community. They have to be willing to work with a diverse population and not judge people. They have to meet them where they're at. So wherever that person is at in that stage of their life and they're seeking help from us, they need to be able to meet them where they're at, not pass judgment. Let's say if the person has an addictions problem, not look at them and say, well, it's your own fault that you're struggling with this addiction. But now what do we do from this point, where you're at today, to move forward? And so those are the attributes that I'm looking for with people that I recruit to come work for us.
Yep. And so let's talk a little bit about the different career paths in this field, right? Let's start about maybe an entry level, and then talk about some of the higher credential opportunities within the field.
Sure. Starting out entry level, a person can come work for us typically as a direct support specialist. Basically, they may have a background as a caregiver, like a nursing assistant, home health care, or something related to that. Another avenue would be youth care workers, and that's working like with our Bellwood and Brookline offices. Those are residential homes where they work with youth, and we provide all the training to them And they go through a 3-week training program. And from there, it's basically working with youth, troubled youth. A lot of times the parents are caught up in the court systems or the children are headed towards foster care. And so it's basically, as long as you have a compassion for kids and working with them, we will train you. And then you kind of grow from there. Other areas is office work. If you have just worked in an office somewhere, typing, receptionist, filing, then that's another avenue to start a career path with us. And then you can go up from there based on what you're looking for.
Okay. Kourtnee, did you want to add to that? Especially because your route was, I would say a little bit more traditional, right? Earning your undergrad and then your master's degree.
Yes. And so coming out of school, I initially started off as a clinician. So I started off doing in-home with 7 counties, and then I transitioned to office-based. After 5 years, I was able to move up. So there are opportunities to be able to move up in the field. And so then I'm now in my current position, which is the clinical supervisor at our site. And so to know that like, it's not, once you get into the field, you're stuck at that one position, there is opportunities to be able to move up. And another thing that has been interesting at 7 counties that I've been able to do is like also being able to branch out, being able to be a part of like trainings and help with training new staff and getting them on board and getting things get them set up to be able to be successful as well.
Wonderful. And so we actually have a summer works program, right? And so the young adults there start as early as 16, trying to get experiences in a variety of different fields. And we have a cluster for healthcare, especially with 7 counties, Ludmilla. Do you have to be 18 or is there opportunities for someone at 16?
For us, the minimum age is 18 years of age that you have to be to start a job with us.
Okay.
So typically it's right out of high school, once they complete high school.
Okay. So we've talked a lot about getting into the industry. So let's talk a little bit about staying power and retention. A couple of weeks ago, Louisville Business First held a Mentoring Monday event, and it's an opportunity to provide mentorship opportunities in connecting more seasoned individuals with women that are just now trying to get their feet wet in their careers. So I have mentorship on the brain. Can you both talk a little bit about the mentors that you've had throughout your career and the value you found in those relationships? We can start off. Yes.
I can speak to that. Definitely, I would say the supervisors that I've had over the course of my career have had a huge impact on my career, and I keep in contact with them, even if they're not my current supervisor. But I keep contact with them, ask them for advice and direction for every move that I make in my career. I like to consult with them to get that guidance. But I remember starting in my career, and I needed that additional support, and I didn't not take advantage of that, of like, I need to consult, I need to brainstorm, I need to pick their brain. And I also wanted to absorb as much knowledge and wisdom that they had, and so that I can carry that on. And I find myself as a supervisor now sharing that same information that I got from them with the students or the staff that I currently supervise. So I definitely value the previous supervisors and current supervisors that I have, because they have more experience than me, and so I value the wisdom that they have.
Okay, wonderful. Ludmilla, you want to talk to us about your mentorship interactions?
I would say mine is very similar to Kourtnee. I've had mentors, usually previous bosses, managers that I've worked for, and developed those relationships with them and went to them for advice, as far as a career path. what I need to do to grow, and even changing positions if I was going in a different direction. And so I have stayed connected with previous managers that go back 30 years ago, where I still have those relationships with them. And we've gone from, that employer-employee relationship to now a friendship that I can count on them for advice.
Absolutely. And I know we're talking specifically about the mental health industry, but mentorship covers all avenues, right? No matter where you are, finding someone that could be that sounding board that could provide that direction and kind of help you along the way, right? Is extremely important. So I would love to hear how do medical professionals network, right? So we talked a lot about mentorships. I know I go to a lot of networking events, but you don't find a whole lot of folks in the medical field sometimes at those events. I don't know if it's because of the hours, or maybe it's a little bit like a secretive club that folks like to hang out. But interested in hearing from you, starting off, Kourtnee, how do medical professionals like yourself network?
I know that they definitely have different conferences that a lot of people will go to, like there's the Kentucky counseling conference that they have, and then they have the MFT conference. Some of them are locally, and then there's also some that are national. And so I know that is a way a lot of people collaborate and be able to network with one another about resources and what's new, techniques that are new. And a lot has shifted to online. And so when you think about online, there's different resources online that people are able to collaborate with. And I know, interestingly enough, a lot of my staff will say they are joined in different groups on Facebook where they kind of network with each other about resources in the community. And so they will use social media as a way to also communicate with one another about resources.
Wonderful. Ludmilla, love to hear how you network.
Well, from the HR side of it, I network with LSHRM, which is our local human resources management group, and then also a member of SHRM. I also stay in contact with other people that I've met over the years. While I worked in healthcare, I stay connected to those individuals, regardless if they're a physician, if they work in a manager capacity. And that way I can stay abreast of what's going on in healthcare.
Absolutely. I will say that Ludmilla and I have crossed paths in many networking circles over the years. So I'm getting to know Kourtnee, but I do know Ludmilla is an expert at networking. So just really getting out there and meeting new people. All right, so let's talk a little bit more about your work. And we'll go ahead and ask this question to Kourtnee. What is fulfilling about your work? And then on the flip side of that, what causes you the stress? What are some pain points?
So the first question you said was what brings what things do I like about my job?
Mm-hmm.
I would definitely,
yeah,
fulfilling. Yes. This work is hard work. It is, but I love being able to see that change, that positive change, that healing that comes with the therapy that you are able to provide to the clients, and to be able to know that like it may be impacting this one particular family, but this may be generational. It goes beyond that one family. And so I love the fact that it goes beyond just the client that's in your office, but it could be impacting this family from generations to come. And not only for that family, but for the community. And so I have loved the fact that I can at least be able to be a part of that and be able to see that healing that families are able to get as well. Now, on the flip side of that, what are some of the challenges? There's lots and lots of paperwork that comes along with this work. And so you do have to be organized and be able to keep up with things and be able to also one of the key things is also self-care. You have to be able to be disciplined enough to know, like, okay, I need to take a day off. I need to, schedule my appointment out a little bit further just so I can take care of myself, like to take care of yourself in the midst of also doing your job at the same time. So I think that is a key thing that a lot of people have to learn. It's like, oh, I can't just always be available to my client, but I also have to take care of myself in the midst of that.
Yes, self-care is so important. So important. Thank you for mentioning that. Ludmilla, what is fulfilling about your role? And again, what causes you stress? Right now, we know that there's a lot of job opportunities, but even in my role, we're not finding a whole lot of job seekers attending these events, right? So is that an area of stress on your end?
That can be an area of stress, definitely, because I want to be able to serve our various departments and help them to find the right people that they can work with as a team so they can service their clients. And so, yes, definitely, I would say with the environment that has changed with job seekers, a lot of people have left the workforce. So yeah, that can keep you up at night and thinking, okay, what do I do next to try to find the right individuals and excite them about the passion that we have for serving our clients. So yes, that can be a challenging aspect of it.
And so what do you love? What are some of the things you love about your job?
Well, it's twofold. One, I always tell people when I interview for positions is that I want to help you find the right career path, something that you can get excited about. And that if I was to call you up 5 years from now, you're still with the organization and hopefully you're growing with the organization, but this is something that you really enjoy. The second part of it is that in an indirect role, as part of the support team, I am helping our clinicians help their clients. So it's like physicians. We're giving back to help them help their clients or their patients so that they can meet their needs. And so that's what I'm doing behind the scenes. I'm giving back to the community. That's what I get excited about.
Absolutely. Everyone has a role, right?
Mm-hmm.
Everybody's role is so important. And I can say again, Ludmilla, you're such a people person, right? And so there's a lot of authenticity about you. And so someone that is encountering you and the statement about making sure that this is the right career path, even if it's not, I know that you have that conversation with them and can direct them in a place so they could have a chance to encounter something that works well for them. So, and it's nice to have those, right? There's so many times the first interaction is almost a little bit like a checkbox, but you bring the warmth, the expertise, and that I'm really trying to be of assistance to you and find the best people and persons to work for 7 counties.
Thank you.
All right, so as we near the end of this conversation, I'd love to provide to people that are listening or watching, what resources would you recommend to people interested in working in this mental health field? Now, Kourtnee, you started off a little bit mentioning that there's a lot of social media resources, Facebook groups, any other resources that you can think of and provide. Although people that are listening and watching, there's 2 resources right now, right? Ludmilla and Kourtnee have offered their time and their expertise. So they're definitely 2 resources, but any others we want to mention to anyone that's listening?
I would encourage people to go to 7counties.org and explore some of the positions that are on there, but also, to see what is available, like what are the fields, what are the positions that people are doing in the community. And then I would also, if you're interested in going into this field, I know a resource that a lot of people use is like therapyaid.com. They go on there and you can look at different resources that people are using in session, if that is something that you're interested in. And I would encourage people, there's so much information on YouTube, to go on YouTube and kind of do your research. I think sometimes people just jump the gun and say, I'm just going to go back to school, but kind of take your time and figure out, like, once I get this degree, what is that going to look like? And so do your research before, but I would encourage people to go to 7counties.org and look at what are the positions and what does that look like and what could I move up into? So that would be my recommendation.
Wonderful. And then, so you mentioned therapyaid.com in addition to 7counties.org.
Yes.
All right, Ludmilla, someone walk up to you, interested in the mental health field. What advice would you give them? What resources?
I would tell them, again, to also research the area that they want to pursue. I mean, like at 7 counties, we have several divisions. So do you want to work in child and family services? Do you want to work in addiction services? Do you want to work with adults with mental illness or developmental disabilities? What age group are you wanting to pursue? And then what type of job do you want to be involved with? I mean, you can go from the entry-level position, you could become a case manager where you're helping individuals find resources that they need to help that person in that recovery process that they're struggling with. Also, if you want to become a clinician, what type of degree are you wanting to pursue? Is it in psychology or social work? And then get your master's degree. And then your licensures from there. If you want to be a CSW or LPCA or LPCAA or LCSW, I would tell people to really consider where they want to end up at. What is their goal, even if it's 5 years from now and then 10 years from now? And where do you think that your passion will lie at with the group that you are servicing? What's the demographics that you want to help?
Wonderful. So let's end by expressing anything that we didn't cover that you guys may wanted to share. Ludmilla, I'm sure that there are a lot of opportunities right now within 7 counties. Let the people know how to get in contact with you to follow up. Okay,
they can reach me at 502-589-8600. They can call, that's our HR, for our HR number, they can reach me that way. They can also reach us at talent acquisition at 7counties.org. And that way they can talk to me or one of the other HR professionals about career opportunities that we have to offer. And we're glad to have that conversation with them and help them to decide if this is something they want to do, and then possibly look at a career path that they're interested in. One of the nice things that we do is that we do offer tuition assistance. So if somebody is wanting to go that next step and get that degree and maybe the finances are not really available, then there's a possibility that we can help that person with the education that they need, or if they already got the degree and now they want to figure out where to use it, I can sit down and talk to them about that.
Great. Kourtnee, anything else to add?
No, I would encourage anyone that is interested in the field to like I mentioned, do the research, kind of explore what you want to do, what population would you want to serve, and then I say go for it. Definitely don't hesitate if you know that you have that burden on your heart to take that leap and just try it, and then you figure out what is going to be the best fit.
Absolutely. Well, great. Thank you so much, Kourtney and Ludmilla. This was a very exciting conversation. You guys both dropped some really great gems. I really appreciate hearing about both your journeys into this field, what your day is like, and just answering some of the burning questions that someone, a job seeker, might be thinking. So definitely appreciate both of your time. And again, make sure everybody check out the resources that was mentioned here on our KW Conversations. And yeah, we concluded another KW Conversation, and we will talk with you soon.
Thanks for tuning in to KW Conversations. Visit KentuckianaWorks.org to find labor market data, resources for job seekers and employers, and much more.